Welcome to the Birth Squad podcast. If you're riding with the squad,
hey fam!
And if you're new,
welcome to the squad. We're your hosts, Dr. Ijama Okwando and Dr. Kamisha Thomas. We're two licensed obstetrician and gynecologists, as well as best friends.
The Birth Squad is a podcast for birthing individuals by two Black female physicians who use stories from real women to educate about pregnancy, birth experiences, reproductive health, and all things in between.
And while we hope that you love learning from our podcast, it is not intended to be a substitute for medical advice, diagnosis, or treatment. So please consult your healthcare provider for your specific care. And to learn more about us and about the podcast, please follow us on Instagram at The Birth Squad. And also check out our website, thebirthsquad.com.
Please keep in mind that some of our episodes may cover topics that could be triggering to some individuals. Listener discretion is advised.
Meet Dr. Aldene Zeno. She's the next badass birth warrior who will share her story and help the squad navigate through the complex and inspiring journey of pregnancy, labor, birth, and motherhood. In this episode, we are talking about exercise in pregnancy and in the postpartum period. This is a topic that has a lot of mixed messaging in the media. During the interview, you may notice some medical terms or jargon, but don't worry, we got you. We have included definitions and explanations in the episode description and notes. So please listen up and enjoy her story.
Well, welcome everybody back to the Birth Squad Season 2. I'm Dr. Kamisha Thomas.
And I'm Dr. Ijama Okwando.
And today we have an amazing birth warrior that's going to share her story and her life with us, Dr. Aldene Zeno. So she is a trained OBGYN and a urogynecologist by trade. She's also an author. She wrote an amazing book talking about pregnancy and fitness, and we'll go over that today in our interview. And she's also a personal trainer as well as a mom. So welcome to the Birth Squad, Dr. Aldene Zeno.
Thanks for having me.
So we want to kind of start the journey and the conversation today talking a little bit more about you. Like, you have a lot of hats that you wear, and we're curious what got you on your path. First, let's talk about with medicine. Like, what got you interested in being a urogynecologist? What is a urogynecologist for those out there who don't know?
Yeah, I mean, as far as being a physician, I've always been into like sciencey stuff. I originally wanted to be a marine biologist just because I like dolphins, but I think it's partly having an immigrant mother and this being kind of a traditional role that a lot of immigrant parents see as being successful. But I think that just kind of also met my interests in medicine, and she was a nurse also, and so I remember playing with her blood pressure cuff and her like suture removal kit when I was little. When I was coming out of high school, I originally thought I was going to go into nursing school, and one thing I really do credit her with is just helping me see myself as a physician, even though that wasn't something I was seeing a lot growing up. I personally had a pediatrician who was Black, but I didn't have a lot of like other experiences with physicians as people of color. And like, we also grew up experiencing poverty and that kind of thing. So it really, even though, I had good grades, all that stuff, but, just didn't seem like that was going to be me. And then as far as urogynecology goes, I originally went to OBGYN because I like doing procedures, and I thought I was going to do family med and to do like maternal child health and do more deliveries and that kind of thing. But I was fortunate to have several international experiences, including I went to the Philippines as a medical student for a month and was there with my mom when she was getting her BSN as a nurse, which was a really cool experience. But then I went back as a third year med student, and then also had the opportunity to go to Guatemala with a urogynecologist. And my experience in residency was that urogyn was I was in a more affluent area. I was in the Bay Area, and I thought it was more of a like a cosmetic thing. And I don't think I thought it, is more, like bougie people that just want their like labioplasties, or, they want their labial trimmings and to tighten things up down there. Um, but the issues that we deal with in urogynecology are so prevalent. At least half of women postpartum are dealing with incontinence or some degree of prolapse. And as we go through menopause and get closer to 65 and above, somewhere closer to 2/3 of women are dealing with issues related to incontinence. And that has a huge impact on
Mm-hmm.
nursing home admissions, on quality of life and mental health and productivity and image and self-worth and things like that. So doing those international experiences and seeing how universal these issues are, and being able to address that through often through procedures, not always surgery, but often through procedures that can be true, I call them true gynecology procedures, because they're a lot of vaginal procedures, but to have that kind of impact and to make a huge difference in somebody's quality of life that way was very impactful for me.
Wait, so Dr. Zeno is an OBGYN, right? But doesn't she deliver babies?
Now, Kamisha, this is a great question. So after medical school, someone who's interested in OBGYN does 4 years of a residency, where we learn how to deliver babies and perform surgeries. We also get to have some exposure to subspecialties.
Now, what is a subspecialty?
Well, in OBGYN, there are 5. Number 1, family planning. That's where we deal with complex contraception as well as provide abortion care. Number 2, maternal fetal medicine. They specialize in high-risk pregnancies. Number 3, oncology. These are surgeons who care for patients with cancer. Number 4, REI, also known as reproductive endocrinology and infertility. They are fertility specialists who are trained to manage endocrine issues like menopause or polycystic ovarian syndrome, also known as PCOS. And number 5, urology. These doctors focus on leaking of the urine or stool, urinary frequency, pelvic organ prolapse, or some of the other cosmetic issues like a labiaplasty that Dr. Aldene mentioned.
And all of these subspecialties require additional training called fellowships. These are specialties and training that requires anywhere from 2 to 4 years.
Check out the podcast description for the explanations on some of these terms that were mentioned in the podcast. There you can also find more information about Dr. Aldene Zeno. Now let's hear more.
And now, being in private practice, I'm kind of experiencing another iteration of dealing with pelvic floor disorders in a more community-based setting, as opposed to academics, where I was for the previous first 3 years after my training. So again, I think for me just has reinvigorated my commitment to clinical care and to being a resource in the community, and being accessible to my patients here, and also through avenues like this, and other options, whether it's social media or writing or podcasting or whatever, to talk more about these issues that are just so common but also very taboo. So
Yeah. We really appreciate the work that you do, because you're right, it does affect so many women. So I want to kind of like transition it into talking about your experience, your personal experience, and motherhood specifically. So if you don't mind, I'd love for you to share with us your path towards motherhood.
I'm one of those people that grew up in a pretty conservative or religiously conservative household, and I definitely internalized a lot of those beliefs, and I got married pretty young, and thought, okay, I'm going to finish my training, got the husband, I'm going to get the degree, and then I'm going to plan this motherhood thing out. And life happens, and you gain wisdom and everything, and I found, or even though I'd been dating this person for a while, I found early in our marriage that it was just not going to be conducive to the type of relationship I wanted to have in marriage and family and things like that. But I still, carried this desire to want to have a child. And so we did end up getting divorced, but, thankfully I was blessed to meet my current partner, and we both have similar like family goals and things. And I definitely, because of my experiences, kind of reframe what it means to be a woman, what it means to have worth as a woman, what it means to become a mother, and like do that in the context of, a quote unquote non-traditional family, even though, you know, somewhere around like 40 to 50% of women of families are blended. So I, gained those insights. And originally, as we, my current partner and I were thinking about this, he'd had experiences with male factor infertility in the past. And um, I'd never been pregnant before. So, at the time I was like, oh, we'll see kind of what happens kind of thing. My friend calls it pulling the goalie when you take out your ID, but I was, thankfully I was able to get pregnant in, less than a year. And, thankfully I had a healthy, normal pregnancy. And becoming a mother, I think, is exactly as I thought it was. Like I felt like I knew a lot about pregnancy, labor, delivery, having been trained as an OBGYN. And like to an extent that became true, but being a parent is totally different, and definitely learning as the learning as you go experience, as much as I think one wants to be prepared at things. So
Nice. So your book is called Thriving Through Pregnancy with Fitness and Black Mama Magic, and it talks about fitness and pregnancy. It's like what led you to writing the book, and then what was your like personal experiences that kind of contributed to that? Because you have great
oh,
photos
thank
in
you.
here. Like I was showing Ijama some of the photos that you have in here from your pregnancy, and like you exercising,
Uh-huh.
during pregnancy. So I would love for you to kind of like speak a little bit on
Oh,
that.
yeah. And I should shout out my book contributor, Siobhan Robinson. She's a athlete and personal trainer herself. I do also have pictures of myself during my pregnancy. And one thing I will say, speaking about, the kind of path to motherhood and things. And I think a lot of, people have this ideal, or and athletes probably especially, to get themselves kind of body ready for a pregnancy. And for a lot of people, that means through, fitness and getting to a normal body weight and things. And I talk a lot in the beginning of the book, like I have a whole chapter on preconception about how I had to learn through my own experiences that fitness was just a part of that journey towards, wholeness and wellness. And I had to put that together with the personal work, and, going to therapy, and, developing wellness techniques, for myself, in addition to having a healthy relationship with fitness. So at the time, I was also unpacking a lot of emotional stress. So I did start going to therapy, but, in my mind, a healthy outlet for that was also to be active and to do fitness. And as much as I love CrossFit and certain things about CrossFit culture and functional fitness in general, it's definitely easy to get wrapped up in that, and to also take that to a negative level where you're using that in what's not intended for. Like it's not intended to also substitute for, you know, the, emotional connection with actual people in your life. And for me, like began that, I noticed, in hindsight, became part of the issue in my relationship with my partner at that time. And so on one hand, I was achieving that goal of becoming very fit. I was in the gym like a couple hours a day, several times a week, and I started doing competitions and things. And then I ruptured my Achilles tendon, and I don't think it was specific to CrossFit. Like I've been active my whole life. I was one of those people that like dabbled in a lot of things. But so for me to do CrossFit was a kind of a natural transition. It's kind of like adult PE, and can become like a team sport. Again, like I definitely sacrifice certain things. And so definitely like having a kind of a very significant injury like that, where you have to just literally sit down for several weeks or months and then just having that slow recovery, you have nothing to do but to kind of rethink what you're doing in your life and things like that. So I came into fitness and like preparing for pregnancy with certain things in mind, but definitely learned things along the way. And I would say I eventually, was able to, I think, develop a healthier approach to that. And, thankfully now, like my partner and I share that interest in fitness in common. And we can connect that way, but we also have this commitment, obviously, to our kids and to our family and to thinking about their futures and, doing that together. So definitely, becoming a parent helped me kind of reframe so many things in a lot of ways.
So, Aldine mentions preconception and a normal body weight. What does that mean?
Well, preconception is the time period before you actually get pregnant. This can be when you're just thinking about it or when you're actively trying to conceive.
And what do you recommend people do during this time?
I always tell people that we want you to be as healthy as you can be prior to conception. But what does this mean? Well, if you have other health issues like high blood pressure or diabetes, then it's making sure that those issues are well controlled. This could be with or without medication. It also means talking to your healthcare provider if you are on any medications to make sure that they actually are safe in pregnancy prior to conceiving.
Now, if you all remember in Aparna's story, season 1, episode 10, we will often keep you on the medication you are taking for mental health issues. So don't forget that being in good health also includes your mental well-being.
Exactly. And what people don't realize is if your health issues are not well controlled outside of pregnancy, then they might actually worsen during pregnancy. So, step 1 is to make sure your health issues are well controlled and to avoid toxic habits like alcohol, cigarette, or drug use. Step 2 is to start taking a prenatal vitamin at least 1 month prior to when you're trying to conceive.
This can be any over-the-counter vitamin that has at least 400 micrograms of folic acid or folate.
Now, another question that we often get is, what is a good weight to be prior to getting pregnant?
Well, we don't think in terms of good versus bad weight. Often, your doctor will use a BMI or body mass index as an indicator of how much weight we recommend you gain during pregnancy. The general principle is if you are underweight, we'll tell you to gain more. And if you have a BMI greater than 30, which is considered obese, then we recommend gaining between 11 to 20 pounds.
Now, the truth is, most patients will fall somewhere in the middle. Now, don't focus on the number of the scale. Let your doctor worry about that for you. And remember, pregnancy is not the time to try to lose weight or diet. If you need help, you can always talk to a nutritionist or to your healthcare provider.
Now let's hear more from what Dr. Aldene Zeno has to say. What do you think that you did that was really successful during your pregnancy? Or what would you tell your friends and your family? Like, these are the things that I would recommend for you to do to kind of maintain your health during pregnancy. Because what we see a lot of is people are afraid to do anything, right, in pregnancy. Like, can I walk? Can I run? And so I always tell them I knew someone who did CrossFit in pregnancy, and I always keep you in mind. But like, what's the big takeaways that you want people to know about?
Yeah, if I could boil it down to 2 key points, one key point is that exactly what you said. I think a lot of people overestimate the risks related to being active and being pregnant. So when I love the recently updated ACOG guidelines on fitness and pregnancy, because they're much more evidence-based and they're very clear. Like, we want people to participate in moderate level exercise in the same way that we recommend for people that are non-pregnant. The difference is that your body goes through these changes and you have to make modifications. But the thing that remains the same is this idea of relative perceived exertion. So when we talk about like moderate level activity, that means that you have difficulty completing a complete sentence while you're active. So that point remains the same. But that means, yes, when you're pregnant, potentially walking, around the block or doing a brisk walk is going to get you to that point. Whereas, pre-pregnancy, you might have been running or whatever. You just have to kind of pay attention to what that means for you at your point in pregnancy. And also, that changes as the pregnancy progresses. Like first trimester, early second trimester, you probably don't have to change very much. So that, that point about staying active is just so key because so many Americans especially have sedentary lifestyles. And I do think it's also especially important point for Black women in pregnancy, because as much as I think a lot of the stats that are coming out about Black maternal health, they're so important about the risks, the relative disparities in maternal morbidity and mortality, the relative disparities in low birth weights and preterm births. But overall, those risks are low. Those disparities need to be addressed, but those risks are low, which means that the most likely thing to happen for most Black women in pregnancy also is that they're going to go on and have a normal pregnancy and normal delivery. So with that said, it's just as important for us to also uplift stories about successful, active women in pregnancy, which is part of the driver for me to write this book. But the second point that I think is also important is that I think a lot of people are having this better awareness about, okay, it's, safe to be active in pregnancy. But a lot of the guidance that I hear from people in the gym or in fitness culture is that, well, if you're doing it before pregnancy, then you can keep doing it. And that's not necessarily true either. And I realized when I was writing the book, and I've reread it so many times now, but I spend a lot of time talking about pelvic health because a lot of the things that I deal with when it comes to things like incontinence and chronic pelvic pain and prolapse, these are things that a lot of my patients are dealing with 10, 20 plus years down the road from their pregnancies. Usually it's at that point that it gets so bad that they need attention, and also they're kind of out of that, taking care of young children phase. But I think that for what I hear from a lot of my patients is that if I had known this, I would have done things differently. Unfortunately, we don't have a lot of great evidence on prevention when it comes to pelvic floor disorders, but there are some common sense things that people can do differently. So I talk a lot about, like, if you're leaking while you're doing squats, don't keep doing that. And you might have a higher risk of doing that in pregnancy because of some of the hormonal changes and the physiologic changes and that kind of thing. So, other things like if you were lifting heavy before pregnancy, you still have to keep in mind, the relative changes that are happening in your body, where yes, you are going to get shorter breath faster. You are going to fatigue faster as the pregnancy goes on. And then certain movements, especially, some people get really bad hypotension or low blood pressure in first trimester, second trimester. So there's certain things like movements, if you're doing like burpees, for example, where you're jumping up and down a ton, or you're putting your head below your heart a lot, like that might make you more prone to get dizzy, or as the pregnancy is going on too. But my belief is that those movements can be modified. It doesn't mean stop exercising, unless, again, in certain situations, high risk for preterm birth, or, if there's other things where the obstetrician says that they need to avoid certain activities, yes. But I think the challenge also for us as providers is that we're also, as a community, are giving mixed messages to patients. So a lot of patients are like, I don't know what to believe. So I tried as much as possible to stick to evidence-based guidance in my book, but to also use that through my own experience. And I really didn't see a lot of that when I was looking for something like this, a resource like this. And it was during the pandemic, and there's a lot of influencer experts who are posting on this stuff online, but there's not a lot of great research behind it or a lot of evidence behind it. So that was a lot of, the impetus for me to write this, was to hopefully inspire people through my own experience, but also to provide some evidence-based guidance.
It is, I mean, definitely needed. And I think, it's funny because I think patients think we get trained on everything. Like we have like in training, we have a class on like the right
Mm-hmm.
underwear or the right like products to
Yeah.
use or the right hair
Yeah.
dye to use. But we
Right.
don't, right? And ACOG comments on it, but there's no class on fitness and
Right.
pregnancy. So I think your book is very, very important and it's very needed and it's a important voice to be heard, and it's such a unique perspective as a urogynecologist too, right? Knowing a lot about the pelvic floor, which plays a huge role in our fitness and a huge role in
Mm-hmm.
pregnancy.
Mm-hmm.
So, like, I just want to take a moment to say thank
Oh,
you for taking the time to write this book because it is really, really important. I want to ask you, thinking about your prior experiences and your knowledge as a urogynecologist, do you think there's anything that really helped you, like during delivery, like some things that you did during delivery or immediate postpartum that you can like pinpoint that you feel like really made a difference for you?
yeah. One thing I talk about in the book is that there is evidence to show that people who are engaging in moderate or even high intensity exercise throughout their pregnancy go on to have a lower risk of C-section, and they're more likely to have normal birth weight infants and less risk of large for gestational age infants. And we, as you guys know, but that improves your chances for a healthy delivery. It decreases your risk for birth related injuries and increases the chances for the baby to have themselves less injuries during their delivery, and also for the baby to have a better metabolism and lower risk of low blood sugar after delivery or hypoglycemia in neonates, which we associate usually with larger for gestational age infants. So there's so many benefits, and I had that in mind, and I do think that helped in my experience with having essentially a normal labor and a pretty unremarkable delivery as far as when it comes to medical stuff. Obviously for me it was a very remarkable experience, but my partner always jokes, he's like, you like basically delivered your own baby because I came in and I had my bag of water had ruptured. I don't know how to describe it, but I felt confident that my body would do the right thing, and thankfully it did. Like I'm not so hard headed to have stuck to my guns if I truly was stalling in labor, but I knew what a normal labor curve was, and I knew that for people that rupture their bag early, most go into active labor within 24 hours, and that's exactly what my body did. But one thing that if I had worked with a midwife, now in hindsight, I knew like that day, I remember I was so hungry. I ate like nobody's business. Like I think we had McDonald's for breakfast, then we had ramen for lunch, and then we went to Cheesecake Factory. And by the time I got to Cheese Factory, I was like, oh, I'm starting to feel a little nauseous, but let me power through these tamales real quick, this tamale cake. But so I think a midwife would have probably counseled like, oh, like that's very common when people are like getting ready to go into labor, and you want to make sure you pace yourself, because once I did start going into labor, I would like the thing that made me get an epidural really was the throwing up. Like I hate throwing up, but it was like with
Mm,
every contraction, I was just like, ugh, like, and it was like all that junk I'd eaten for that day. And it was funny too, because like I knew having ruptured my bag that I, wasn't having contractions yet, but I knew that I would probably in the next like few hours. So, anyways, once I got the epidural and like the nausea calmed down and things, again, thankfully I progressed in labor, and I literally pushed over one contraction, and I think I had like a superficial tear that they put a stitch in, but um, I was really thankful to, I guess, have the knowledge that I have, and to also feel confident that my body would, do its thing. And obviously, not everybody has that knowledge or can feel empowered enough to advocate for themselves in that way. Like, I remember when they called me complete, like, so I'm 10 centimeters, but in the head's there, but it's not like down far enough where I would push a little bit. I was like, oh, I think I'll labor down a little bit. Like, again, not to like say I was trying to dictate my labor, but I knew I didn't want to push for 3 hours. If I knew like my body would kind of do that on its own, I could start pushing when I felt that pressure, that urge. And I definitely felt that, even though I had an epidural and they checked, the head was right there, and she was ready to go. So I think that experience, that my prior training and the knowledge and things like helped me get through that experience. Postpartum, I think I'd known enough about pelvic floor PT. I'm not obviously not a pelvic floor PT myself, but I knew enough to understand some of the things that I could do to early on, like I'm talking about in the first 6 weeks. And I have a whole section in the book where I talk about that, because a lot of people, again, they get this guidance after they deliver. We often say no heavy lifting, no submerging of water, and nothing inside the vagina for 6 weeks, right? But you know what? I think that there's a lot of things people can do. And if you're already picking up like a 7 to 10 pound baby in the first 6 weeks, like you can do things with light weights too. And you can do things that might help to, reestablish your connection with your core and your pelvic floor, and put you in a position to prepare for, returning to activity over the next few months.
So, what are some common symptoms a pregnant person might experience during exercise?
Well, Aldene mentioned a few of them. Number 1, shortness of breath. This happens because the uterus is displacing your organs, making it really hard to take a deep breath. Number 2, dizziness. This can occur because your blood vessels are very dilated, so sudden changes in position can make you feel dizzy. Or it can be due to an issue called anemia, which is low blood levels. Number 3, tachycardia, or an elevated heart rate, which can make you feel more fatigued. Okay? So these are some common issues that she mentioned that could really make you kind of feel slightly different when you exercise in pregnancy.
But if you notice persistent symptoms outside of exercise, you should absolutely notify your healthcare provider. Okay, now back to Dr. Aldene Zeno.
So I think I had a basic understanding of that. Again, like that experience helped me understand the importance of, deep, like core breathing and reconnecting your breath to your core. I talk about in the book how it felt like my belly button had detached from my body. And I think that's the weirdest thing if you're someone who's athletic or who's been active for most of your life, you're used to feeling some sort of control over your activities and,
Mm-hmm.
Noticing like, oh, if I do this, I'll get stronger here. Or if I stretch that, I get, more mobility or flexibility there. But being postpartum, I was just surprised by how, after the baby came out, I was like, it should be easier to get up out of bed now, right? And like that first 6 weeks, just that combination of fatigue and the way that your abdominal muscles stretch out and everything, like you just have to give your body that time. So I do think I had a base understanding enough to start some of those simple exercises in the first 6 weeks. I didn't truly appreciate how much time it would take until I got farther in the process and talked to more moms and talked to my friends who are in PT.
I just want to quickly shout out pelvic floor therapy. Aldene mentioned she barely had a vaginal tear, but still utilized them. Check out Samantha's story from season 1, episode 5 for more information about pelvic floor PT.
Aldene is going to talk more about pelvic floor PT, so let's dive back in.
Like everybody loves to talk about like rectus diastasis, right? Like, and like you kind of talking about your core muscles and the things that you can do. Can you give us a little like preview into that? Obviously, we encourage them to read the book so they can get more in-depth information. But can you give us a little preview into some of the things that you did and how long? You and the moms you talked to, how long was that process to really feel, I guess, like quote unquote yourself again, right?
Well, I think one thing I try to emphasize in the book, and I always say to my patients, is that once you have a baby or once you go through a pregnancy, you're forever postpartum. Like your body is just going to change in certain ways that are not going to snap back. And you're going to gain certain strengths in other ways that are going to be new and exciting. So as far as, some of the things that I did. So first of all, it's important to recognize what it is, because a lot of people, they'll come in with the symptoms of it and tell me about the symptoms of it, but they don't really know what's going on. So yes, it's obvious if there's like a big separation and a hernia, like where there's, kind of this bulge, that's more obvious. And, we can send people to the right providers to deal with that. But for some people, it can be more subtle, and it can show up as more of a pain or discomfort, or just having that like truncal or core instability, low back pain, and that kind of thing. So one way that I check for it is if I'm doing an exam and they're laying down, I have them do a crunch, kind of like they're putting their chin to their chest. And if I can feel a separation in the muscles, like a centimeter or more, then that for sure I would have somebody see pelvic PT. And depending on how far out, or if they've tried that already, potentially see a surgeon. But there are a lot of people who can recover from that without necessarily having surgery. So some of the exercises I recommend early on are, again, that connecting your core to your breathing. So learning to kind of, here, I'll do it with you guys, but if you put your hand on your belly, if you take a deep breath, you should feel your whole belly expand, and then also think about your pelvic floor kind of descending down. And then as you take a breath in, use your belly button to pull it in and up. And then also you compare that with a pelvic floor contraction.
Mm-hmm.
So those are like some of the simple things people can do starting out, even before they start thinking about crunches and things. Like I don't think crunches should be really part of the a fitness program until people have met certain like steps leading up to that. And I tried to outline that in the book. Because once people are able to kind of consciously do that, and I started that pretty much right away postpartum, and I was just surprised again, like feeling like my belly button had separated from my body, like how weird that was to try and consciously do that. But once I felt like I had a better handle on that, and then coordinating that with my pelvic floor, I started doing pelvic tilts, which I talk about in the book also. And if you start that on the floor, but you can do it in the chair, what it means is kind of like as you breathe out, you're kind of going to a neutral spine, but then breathing in, kind of bringing in that belly button and scooping your pelvic bone under you. And once you're able to hold that for 5 to 10 seconds, then I think that that's kind of a safe place to start incorporating certain other exercises that I detail more in the book. But again, something as simple as that, like being able to engage your core and sustain that pelvic tilt position for 5 to 10 seconds, like that's actually kind of challenging when you're postpartum. So again, regaining that awareness and coordinating your muscles is very important. I think that people are getting a better appreciation of how pelvic physical therapy, or seeing a physical therapist who specializes in women who are pregnant and postpartum, just how important that is. So you don't even necessarily have to wait until you have a problem to see a physical therapist. But I do think it's important to acknowledge that access is a huge issue depending on your insurance and where you are, if there physically just aren't people like this around. But if somebody has the opportunity to start that in pregnancy, I would say definitely go for that. But then postpartum, again, there are some providers and PT who are physical therapy that are more experienced with working with women at this stage of recovery, even if you're in the first 6 weeks. So just because you're going to PT doesn't mean you're doing heavy lifting or they're going to do internal work or anything like that. Like there's a lot of things that they can do without any of that. And actually, I talk in the book about using a doula, but basically doing it all virtually because it was the pandemic. A lot of, one of the good things to come out of the pandemic is that a lot of people in healthcare have kind of adapted in that way. And so there are several PTs even here in Los Angeles, and I'm sure in other parts of the country, who are offering treatments and assessments and things online. So, hopefully people are able to access more. But a lot of it just does come from first recognizing that just because you had a baby doesn't mean you need to suffer. For a lot of women, they'll come to my clinic. Again, it's like, whether it's within that first year postpartum or 10, 20 years down the road, they'll say, how come my doctor never told me about these resources? Or how come, I tried to tell my doctor and they told me it was just normal. Like it's from all all my pregnancies and stuff. And, so we have a responsibility too, as providers, for making sure people understand that these resources exist.
So you've hit on a lot of amazing points, but is there any like big misconception, like maybe you see in social media or maybe you hear people tell you, is there a big misconception that you would love to address and like share?
One, a plug again for doulas. And even having worked with doulas in the hospital and friends that are doulas and stuff, I didn't understand how they can play an important role earlier in pregnancy and also postpartum. So in my experience, I'd mostly interacted with them in the hospital setting. And sometimes, honestly, it was a little like, felt like we were not on the same team, even though we're supposed to all have this same goal of, supporting this person through their delivery. And I'd also worked with some amazing doulas too, who made me realize like having that type of support just makes a world of a difference, I think, in somebody's experience and in their outcomes. We know that it does change outcomes as well, if in a good way. So I think that for a lot of people going through pregnancy, they don't necessarily have that village to support them. And I talk about that too, how especially for Black women, we can be vulnerable to experiencing pregnancy with less support compared to other demographics. Considering a doula either early in the process or even just postpartum, having my mom there for like 6 weeks was amazing. And then having a doula for those first 6 weeks was also amazing, because there's certain ways that our moms like were told to do things, and guess what? Things change. So sometimes things can be done better. And I'm sure there's a lot of great doulas out there, but I just got so much great guidance on like dealing with like engorged breast tissue in my armpit. Like that was probably the most painful thing I was dealing with in the first 6 weeks. If I hadn't had a doula and known how to like express the tissue or to massage the tissue in that area, and like I could have potentially gotten mastitis or some sort of infection. So that for me was just huge to have. To just feel that type of support was huge. And again, I did that completely virtually. I had just started my job, so I couldn't afford to be able to access that through like virtual support and still feel that it was helpful. Like that was huge for me. So one misconception, think about birth support in a different way, I should say, and really consider a doula. I think that was a very positive experience for me. The other thing I would say is, again, this idea of bouncing back. Like I talk about in the book how one thing I left out was there's this event that they do at a lot of functional fitness gyms or CrossFit gyms called the CrossFit Games. Well, they put out like these workouts where like once a year you're able to kind of gauge yourself against like everybody in your gym and everybody in your region. So it's a measure in a way of your fitness that comes around like once a year. And my goal when that first came up, and I was like 5 months postpartum or something, again, in my mind, I'm like, okay, I should be recovered by now, right? And my goal was just to do everything as they had written it. And so to do like all the weights and the movements and stuff like that. And I thought like I was killing it just because I was able to do that. But I really just had to learn an appreciation for taking things slowly. And I think that's hard for everybody, but especially for an athlete. And if you're used to performing at a certain level, things are just different and they can get back to where you were. It's not just like people who see like Heidi Klum who walked the runway 3 months postpartum or whatever crazy stuff like that. But, same with like athletes, we see someone even like Naomi Osaka, who is just like, I think about a year postpartum or something, and now just competed at the Australian Open. And people think like, okay, so that means I should be bouncing back to where I was by X amount of time. everybody's experience is so different. And there's so many factors that go into it. But we do have to keep in mind, like, people who do that for their livelihood, like, they have a whole team of people who are thinking of every single detail with their recovery. And thankfully now we have this precedent where we have athletes that, are able to go back to elite, athletic levels within a short amount of time, in a way that's empowering, but also it also just, I think, takes a little away from the reality that most people really just need time to recover. And I talk about in the book how I walked into a gym. I think now I'm like 6 months postpartum. And one of the coaches, who I had a young kid at the time, she's like, yeah, it really took me like 2 years to feel back to normal. But it really did for me take almost 2 years. Like, there's so many little aches and pains that really just take more time and take some dedication and knowledge to rehab. One of the things that held me up, I would say, was lightning crotch, which was probably a little bit of pubic symphysitis. But these like shooting pains I felt like were coming down my vagina when I first delivered, was like just walking, I would feel that. And so I think I did a 5K, and it was around 11 months. And that was like the first time that I was really starting to be able to run without that. And then I intentionally worked with a trainer myself, and learned about certain imbalances in my body at that time too, to help, recover that better too. So there's just certain things that you just have to give time. And like, if you're a like average Joe or Jane or whatever, like most of the people out there who are trying to get in the gym, then you just have to really kind of pay attention to your body and be forgiving to yourself. And oh, by the way, you're also taking care of a young child. So giving yourself that grace and, accessing the resources where you can, and the consistency will pay off if you're showing up and doing, even if what you think it's the bare minimum and it's just walking around the block, like if you're just staying consistent, paying attention to your body, like things will recover.
I want to take a moment to really highlight what Aldene just said. We cannot compare ourselves to others, not to your favorite celebrity or influencer, and not to your best friend or your neighbor. Our bodies all recover in a different way and at a different rate. But most importantly, it takes time.
And things will eventually recover. Now let's hear how Dr. Aldene Zeno's story ends.
Is there anything else you want to share, like with the Birth Squad or anybody else? And then also at the end, we want to ask, how can they find you and connect with you as well?
If I could recommend anything, I believe that fitness can be a very positive way to, obviously we know, releases endorphins. It helps you sleep better. It helps with your resting heart rate and your cardiovascular health, all that stuff. There's so many benefits, but I do really believe that once I was able to give myself that time, being active and having small children can be such a great way to reclaim your time as a mother. You're giving so much of it away just taking care of children. And then, if you're a working mom too, or working outside the home, so much of your time is divided to things that just are not about you. And for me, I really appreciated, once I got, more towards 2 years postpartum and I was training for a triathlon, just how just good and indulgent like it really felt to take that time for myself. And I don't even think you have to be a mother to appreciate that, but when you're in a mother role and you're, again, just giving so much of yourself away every single day, to be able to take 15 minutes, 30 minutes, an hour, or whatever time you have to be active and to do something that's taking care of yourself, it's just such it's hard to explain, but I say like it's a spiritual experience. I think like if I can encourage any mama to just take some you time and to use it to do something that's going to benefit you mentally, emotionally, physically, just do that. Like that time needs to be yours. I think a lot of men in our society get a pass to just like go to the gym, like, and they don't need to ask permission. A lot of times we feel like we just need to ask permission. And for me, once I kind of flipped my mindset around that and I was like, no, I'm doing this. Like, I'm gonna be gone at this time. So like that's happening. It, for me felt just very empowering and just good, hard to explain. As far as how people can find me, I have a website for people that are interested in looking me up as a clinician, www.draldene.com. So www.draldene.com. I also post on Instagram and Facebook. It's at dr.aldene, but it's spelled out. So doctor.aldene. I also, as you mentioned, have this book, Amazon, as paperback, and I'm so excited for that.
Appreciate you taking the time out of your day to talk with us.
Thank you for having me, and thank you for putting together this podcast. Like, we need more platforms like this to let people just talk about their birth experiences and their stories.
Absolutely, and share their successes too.
Absolutely.
So we gotta lift each other up in the community.
Absolutely.
That's the wrap of this episode of The Birth Squad.
Thank you so much for joining us this week. We are going to continue sharing stories from more badass birth warriors, because at the end of the day, you are the experts of your experience, and we want to highlight you and your bold, brave, and beautiful journey to motherhood.
And we want to hear from you. Tell us about what topics you'd like to hear more about. Hit us up on Instagram at The Birth Squad. And check out our website, thebirthsquad.com.
Most importantly, be sure to share this episode with your squad.
Until next time, I'm Dr. Ijama Ogwandu.
And I'm Dr. Kamisha Thomas.
Peace, love, and solidarity from the Birth Squad.